Alright, just wanted to get this video out. I'm going to follow this this beginning of my video with, I've cut some clips off of Kim Iversen's show where she does some commentary testifying of how they've had very high compliance in Los Angeles for several months with very high mask compliance and lots of lockdowns. They've done everything, and yet look now, January, early January 2021, they're getting slammed among the highest rates in the nation. And then this is a show, the clips are from her show on January 4th. Today is January 19th, and I've been meaning to make this video. We're cut those clips out where she's talking about specifically of the Los Angeles and how they've been so strict about the lockdowns for several months, and high mask compliance. Even they're wearing masks outdoors there. So I think this should be monumental. The example of the failure of both lockdowns and community masking, it's a total refutation of the premise that masks and lockdowns work, but it's being but it's just being completely ignored. And I'm going to talk about that. I already recorded a video, my commentary, and that's what I'm going to put after the clips of Kim Iversen. And unfortunately, Kim said, I think on her stream yesterday, January 18th, on her show, that she said that show yesterday, her stream, that's the last time she's gonna talk about COVID and vaccines, because it sounds like she gets penalized, and this is her livelihood, and so it sounds like it's very hard to get, I'm assuming, monetized, because whenever she talks about the subject of COVID and vaccines, I'm sure she would have no problems if she was going with along the propaganda of promoting restrictions and just promoting vaccines. Oh, I'm sure she'd have no problem getting monetized then, but people seem to get penalized. I know in the Last American Vagabond show, there's never any ads that in front of that those streams, never. At least I don't, not that I can recall. It's possible they've had ads, but it seems like it's very rarely, if ever. That the Last American Vagabond, he talks about how he's another critic of masking and lockdowns and other restrictions for COVID. So it's unfortunate that Kim Iversen is going to stop talking about the COVID restrictions and mask mandates, because she's one of the brightest and sharpest minds in her criticisms of the lockdowns and the mask mandates and the masking, community masking. And so you'll tell with the clips I'm going to after my commentary here. And she has such a fairly wide audience, especially compared to something like myself. She has lots of subscribers, and I think typically with her streams she has little over 1,000 viewers watching the live stream itself. That's pretty high. That's pretty good. And so it's unfortunate that she's not going to be talking about the COVID restrictions and masking. So I guess I'm going to have to try to talk more about the subject, because I can't imagine ever even getting monetized, much less make a living doing this. So I'm gonna play the Kim Iversen clips, and then I'm gonna have some commentary afterwards. Okay, well, thanks for watching.
Many of us called for the economy to open back up because there didn't seem to be much science behind shutting it down, which I live in Los Angeles and you cannot convince me with what's going on here. We have been under the strictest and the longest government mandated shutdowns in the entire country. We have been wearing masks the entire time. And look at where we are now. My point in bringing this up is Orange County is less compliant, fewer restrictions, right next door to Los Angeles. And we've had harsh restrictions, and people are very compliant. LA is very blue. So people are much more, if you go around walking outside without a mask, somebody's going to yell at you in Los Angeles. In Orange County, no one's going to blink twice. But in LA, you'll be yelled at by somebody walking down the street. So meanwhile, Los Angeles has always been worse off than Orange County. I mean, we have just, our rates are soaring. We are worse off. Right now they're saying everything's overwhelmed. It's a war zone in the hospitals. And yet what was our shutdown for 9 months? We kept many businesses closed nearly permanently, some permanently during this entire time. What was the benefit of that when we ended up in the same place as anyone else in the rest of the country? When the virus finally made its way through, it's just going to make its way through. And I don't know what you can really do to stop it, because here in Los Angeles, we haven't been able to, and we did everything. Eventually, they reach their peak and then they drop, because that's what happens. It's not because people suddenly were compliant. It's just that the virus did what the virus was going to do. And that's what's happening here in Los Angeles now. It's not because, people aren't compliant. People are more compliant now than they were in the spring when it comes to masks. In the spring, people weren't wearing masks outside. Now they are, and they have been for the last several months. People weren't wearing masks when they would go running or riding their bike, but now they do. And they have for months before we started going up in cases, well before Thanksgiving. And then people say, well, it's because of Thanksgiving gatherings, but cases were soaring in Europe and Canada. And last I checked, they don't celebrate our Thanksgiving.
So, Kim Iversen testifies that you get yelled at for not wearing a mask outside. It's outside. And they've been doing that since the beginning of this, of all these restrictions for several months. They've been having high mask compliance. And yet, what is the result? Right now, Los Angeles is getting hit at some of the highest rates in the nation. What does that tell you? That sounds like a refutation of the premise that masks are useful in breaking the causal chain of the transmission of the COVID-19 virus. That's and why are we still having all these? If anything, it seems like there's more mask compliance than there was just like a month or two ago. You're seeing everybody wearing masks all over the place. What's going on? Why? What kind of foundation is there to the belief that masks are effective in breaking the causal chain of events that lead to an infection with the COVID-19 virus? Science is supposed to work by looking for refutations of a premise. It's not supposed to look for, scientists are not supposed to look for confirmations, because confirmations can always be found even for mutually exclusive premises, mutually exclusive positions. So you need to look for, instead of looking for confirmations, you're supposed to look for somebody who's trying to support their scientific position is supposed to try to refute the position they're trying to support. And if they fail to do so, then maybe, just maybe, they can make a judgment call that the that their position has been corroborated. But with this specifically in terms of masking, wearing cloth and surgical masks, instead there's this idea that we'll look for confirmations. We'll look for some like Asian nations where it's been for many years. There's been a much more common practice of wearing masks, and some of them may have had much lower incidence of cases and deaths from COVID-19. And they say, "Oh, look at over there. All those that must therefore it's confirmed. We found a confirmation there in some Asian nations that have had low rates of infection with COVID. It must be because they've worn masks. It's confirmed." So it's like they're relying on confirmation bias, the very thing you're not supposed to do in science. You're supposed to look for refutations, not confirmations. And if we look for refutations of the premise that community masking, widespread community masking, is an effective means, when you try to look for refutations of the premise that community masking of cloth and surgical masks are effective, then refutations can be found. And the responsible thing to do for a scientist is, once the refutations have been found to a premise that they were trying to support, the responsible thing to do is to reject that premise. Don't cling on to it. And those refutations can be found in a place like Los Angeles, where they have, despite having very high compliance with community masking, they're wearing them outside. So much so that even if you don't wear it outside, if somebody sees you, you'll get yelled at, as Kim stated. So, and yet, what place is getting slammed the hardest in the nation with COVID patients in their hospitals? Los Angeles. That is a prime example of a refutation for the premise that community masking with ordinary cloth and surgical masks is a refutation of the premise that they're effective at breaking the transmission of breaking the causal chain of the transmission of the COVID virus within the community. It's been refuted soundly. That's all you need. That should be enough to just ditch these masks entirely. Stop with these mask mandates. People should not be discriminated against for not wearing a mask in a store. That should be banned, that kind of discrimination. So not only should the mandates be lifted, discrimination against customers who do not want to wear a mask, and discrimination against employees who do not wish to wear a mask, that should be outlawed, that form of discrimination, because in addition to being the idea that masks help has been refuted in terms of transmission of COVID-19, that the cloth and surgical masks, there is some reason to believe that masks they can cause poor oral health in the population. Now, and I believe I have read or heard that there is a connection between poor oral health and heart disease. So a case could be made that wearing masks for long term could indirectly cause heart disease. Now, heart disease is already a huge problem around the world, and especially in the United States. So are we going to see an epidemic of heart disease in the coming years due to all this excessive mask wearing? I think it is very possible. In addition to that, it could be the case that excessive mask wearing may make the wearer of the mask vulnerable to bacterial pneumonia. So maybe the case that the reason that Los Angeles is getting slammed in the hospitals is because maybe the patients really, the big, what is causing their greatest distress is actually bacterial pneumonia, but there's such a reflexive practice in the hospitals currently to blame everything on COVID, and so maybe the real problem is actually bacterial pneumonia. It's already recognized that the 1918 flu pandemic, most of the deaths were actually caused by bacterial pneumonia. Yet that's even recognized by mainstream medicine. And so there's been some theorizing that maybe the masking, there was a lot of mask wearing then that may have been contributed to those deaths from bacterial pneumonia back in 1918. So maybe it's the case that now many of the cases that are being blamed on COVID are actually the distress, the respiratory distress they're having, maybe due to bacterial pneumonia. It's a possibility. But either way, this idea that somehow necessarily these masking is a benevolent thing in the community needs to be abandoned. It's very possible it could cause a great deal of harm in the short and long term to public health. This excessive mask wearing may be a great public health hazard. Later on down the years, it may even be recognized by mainstream media and mainstream medicine. But for now, it's left up to the alternative media, such as myself, to question this dominant paradigm that's insisting that on the premise that masking is benevolent. Community mass masking is benevolent, and it's leaving just a few of us are calling this out as false. They're calling it into question, and so that's just I wanted to put this forward. Get these ideas out. To point out how the community masking, the premise has been that it prevents COVID transmission or in terms of public health. It's been refuted. The Danish study on community masking that also refuted it, the premise. So I'm just trying to reiterate that and put this out. So I just wanted to get this out. Thanks for watching.